Congratulating the organization, I want to greet all participants. Maria Alexandre Ribeiro and myself, we are going to talk about challenges and practices of research ethics committees in public health emergencies. Allow me to share the screen with you so you can follow the presentation. And we are going to start talking about, or start referring to challenges. The current pandemic has put enormous pressures on the RECs in the fulfillment of their competences, their obligations, and in the compliance with the validated procedures. We have listed a few of the major challenges faced by RECs in Portugal, believing that other European countries have experienced some of the same difficulties. A first one is the unavailability of trial staff and healthcare facilities to pursue the supervision of the running trials. With the outbreak of the pandemic, a large of clinical resource was directed to deal with COVID-19. We refer, for example, to hospital space and equipments. We also refer to healthcare professionals, physicians, nurses, pharmacists. Many of them were infected or stayed in quarantine, thus lacking where they were most needed. Another challenge was to find enough human resources to assess the eligibility of candidates to clinical trials. There was also an enormous difficulty for doctors to follow up on current or new clinical trials, as they were overloaded with work related to the pandemic. A fourth challenge was protocol compliance. It became very difficult to develop all the steps foreseen in the protocol, all the required procedures, even all the mandatory security measures, such as weekly visits, measurements, analysis, and so on and so forth. Thus, it is not really surprising that the deviations from protocol have increased, together with duly reports. This happened in such a high number that became almost impossible to manage them all. A quite different challenge was the shortage and the provision of investigational medicinal products. For example, the closure of borders made it very difficult for experimental drugs to arrive in the country. Besides, there were also serious difficulties in their distribution to the patients who could not, nor wanted, to go to the hospital. Together with these problems, there was also a huge torrent of questions at the beginning of the pandemic, and the RECs did not have the capacity to respond to all of them in a timely manner. On top of all the challenges just mentioned concerning the ongoing trials, there were other related to trial for COVID-19 that started to be submitted, such as many difficulties in preparing a complete dossier as required for submission. Also, on every step of the way, there was a constant and burning need to balance scientific accuracy and ethical requirements that could not be downgraded within the assessment procedure, always urgent, demanding for a decision as wise as speedy. And I could not, the process of obtaining informed consents, comply with all the standards requirements in this adverse situation. Strategy, well, once the challenge were identified, it became urgent to draw strategies to overcome them. Allow me to present a few. A first one was issuing a general document on the new procedures due, adapted to the new reality that is documents clearly instructing sponsors and investigators about what they could and should do in each circumstance, thus also answering in one single document and at the same time to the torrent of questions the regs were receiving. Another strategy was improvement of communication with sponsors and investigators. Streamline communication channels, for example, by replacing official formal communication with simple emails. Also, simplification of procedures, adaptation to internal procedure to new circumstances, simplifying them. For example, reducing the number of monitoring visits. Another example would be to allow participants not to go to hospital pharmacies to receive the drugs, but to receive them at home. Another strategy was the acceptance of notifications of substantial amendments. The sponsor can now register and notify the changes, communicating them only at the end of the process, without needing to request authorization, except in serious cases, those that endanger the safety of the participants. Also, new ways of acting are subordinated to previous risk and benefit considerations. On what concerns new trials, some of the major strategies implemented were adaptation of standard procedures to public health emergencies, being aware of the various constraints for trials due to the pandemic. Standard procedures were adapted, becoming more flexible without downgrading regarding security and safety. Simplification of submission procedures and documentation requirements to be assessed. Beyond adaptation of procedures, their simplification was equally important to facilitate them. Acceptance of different ways to obtain informed consents, flexible, as long as the ethical and legal requirements for it are ensured. Adaptation and simplification of procedures led to streamlining of assessments. It also led to shortening and speed up decision-making process. The strategies developed in the face of the identified challenge led to the implementation of new measures that resulted very positively. Closer communication between regs, sponsors, and investigators. Direct implementation of adapt measures according to with trials specificities for participant safety. Fewer substantial amendments to assess and take decisions. Approval of different ways to obtain informed consent. Working at home, what was not possible before. Virtual, ordinary and extraordinary meetings, gaining more flexibility. Increase productivity, adding trials for COVID-19 to regular work and being able to manage them all. Some data comparing 2019 and 2020 show that more clinical trials were assessed in less time. Also, substantial amendments and notifications, as you can see in both charts. So I believe that although the challenge were really hard, we did manage to take care of the ongoing clinical trials and also to make room to the new clinical trials concerning COVID-19, always without downgrading the ethical and legal requirements for clinical trials. Thank you so much.